Okay, so now I'm going to demonstrate the use of a tool. It's called a Deneroll. It's spelled with an E, not a Deneroll. Sometimes patients think that. This is a cervical orthotic device that is used to traction and help put curve into the neck. Most people have lost some degree of curvature. If we've seen you in our office, then we've taken x-rays to see what curve you have. And based on that curve, we'll place it at one of 3 areas in your neck. When you've lost curve, your muscles and ligaments need to be retrained, and so I'm going to teach the proper use of this to help reestablish curve in the neck. So when you go to lay on it, there is one side that says shoulders this side. That's right there, so it's going to face your shoulders, as opposed to if it's the other direction, it's going to face up away from your head. So we want it to face with shoulders this side towards your shoulders. You're going to go ahead and lay down on it. You're going to put it in the position that has been prescribed for you based on your x-rays. Once you have it in position, if it's uncomfortable, if it's too uncomfortable, then don't lay on it, and you'll need to check in with us and see what's going on and what needs to be done. To start with, there are 3 exercises that you're going to do on it that help to strengthen the curve, strengthen the muscles in the curve. The very first one is you're going to imagine the back of your head where it's touching it, pushing into the Deneroll and holding that for 5 seconds. After that, you're going to relax. You can do that 2 to 3 times. The second exercise is you're going to turn your head and push back into the orthotic and hold for 5 seconds, and then relax, come to the center. You're going to turn to the other side and then push back into it, hold for 5 seconds and relax. This should feel pretty good to do. If you're experiencing pinching or sharp pain or discomfort, discontinue until we can get checked and see what's going on. The last exercise is you're going to bring your ear to your shoulder, and you want to be cautious because the tendency is to look down. We don't want to do that. We want to do the normal lateral flexion of the spine, which is bringing the ear to the shoulder. On most people in the beginning of care, you won't be able to laterally flex very much. You'll feel awkward. And then you're going to push back. When you do this, most patients say this feels good in a weird way, and it's because it's reinforcing the proper curve. Then relax, bring your other ear to your other shoulder, and push back and hold. Once you're done, at this point, laying on it should be a little bit more comfortable if it wasn't initially. You're going to lay in this position, relaxed, initially starting anywhere between 1 and 3 minutes, and you're going to increase a minute a day until you get to 20 minutes. Ligaments take 20 minutes of stretching to 20 minutes to stretch over time. So 20 minutes every day before bed is most ideal. I'm doing this on a table. You'll want to do it on the floor. If you do it on your bed, it's too soft. The Deneroll will push into the bed and you won't get the pressure pushing up against your neck. I have my knees bent. If you're comfortable with them extended, you can lay them down. Most people find it to be more comfortable with their knees up. When you go to get off of the Deneroll, you don't want to just pull yourself straight up. We've been working on recreating the curve. We don't want to pull the curve out. So what you want to do is you're going to want to turn onto your side. If you're uncomfortable, you can lay here for a while. Drop your legs off and push yourself with this top arm and push yourself up. When you're down here, if you try and push yourself up with this bottom arm, you can pull your neck out of place. It's uncomfortable and you can hurt yourself. So you want to push yourself up and get up. If you do happen to fall asleep on the Deneroll, don't worry, just replace your pillow, go back to sleep, and by morning you should be fine. You shouldn't have any stiffness from being on there a little too long. Whenever you're in one position too long, you can get stiff. If you go online to either Apple Store or Play Store, the Android store, there is an app for the Dental, and it has a chart for keeping track of your time on it. The ones we sell have come with that chart in there and explanation. There's also timers in the app so that you can keep track of your time. The cool thing about this is they've done angiograms under MRI, which is kind of studying the blood vessels in the brain, and there's research articles out that show that it increases blood flow to the brain by up to 200% while you're laying on it. So great study tool, or if you're not quite feeling real good that day, get a little more blood to the brain. This is something that you're going to want to do daily till you have curve restoration. At that point, you can back off, do it a couple times a week just to help maintain it. So if you have any questions, give us a call, text, or email.